There are many stories that one could tell about why the United States is less healthy than other countries. Here is one of them. Asian women just across the river from the Mailman School of Public Health in Fort Lee, New Jersey can expect to live to be 91 years of age on average. Native Americans in the Dakotas, on the other hand, live just 58 years on average. Take a moment to think about 33 years of your life. 33 years of your life that you might have just lost, that just vanished out from under you. Now let's look at this from a different vantage point. For those of you who are bad with geography, this is a map of the United States. In this map, what you're looking at are counties colored in salmon for which life expectancy did not increase. Now, this is pretty scary because life expectancy just tends to increase. It's a law of nature. It falls in pandemics and it falls during wars, but otherwise it should just keep on going up. The little salmon colored areas are areas in which life expectancy did not increase, and the little red counties are the ones in which life expectancy actually declined. This map reflects the changes between 1980 and 2014, and the areas in blue are the areas that saw improvement, and the areas in red are the areas that saw a decline in life expectancy. This area where declines were most dramatic is known as the stroke corridor or the opioid corridor or the Bible Belt. All of these are the counties where you see the most dramatic declines. This is an area that tends to vote for Trump, and it's also an area that tends to be quite poor. It's also an area that was unusually hard hit by COVID-19. And I say unusually here because this is an area that's relatively rural, not at all dense, and most people get around by car. It was hit even harder by COVID-19 deaths. If we zoom in on this area, you can see that the number of deaths is higher per capita than New York City. Let's move away from death and destruction here for a second, and let's return to health. I am going to give you a little presentation, and I'm going to do this to contextualize what's happening in time and space. Time and space are my units of analysis. This time around, we'll look at the scenario cross-nationally rather than domestically. What we're going to be looking at is the survival of 45-year-old females and health system investments over time and across nations. So why survival and not rates or life expectancy? Survival is much better because it just looks at the chance that one person is going to make it to a certain age. A numerator and a denominator come from different places. So if an immigrant is in the denominator and leaves the country and just lives somewhere else for the rest of their lives, they will become statistically immortal because they will never be registered as a death in the United States. Okay, let's do a little thought experiment. Look at 15-year survival for 45-year-old white females. So this is the chance that a woman is going to make it to her 60th birthday. On the left axis here, you have the per capita spending on healthcare. And on the bottom axis, you have 15-year survival for 45-year-old females. Let's start looking in 1975. And in 1975, most women in most nations were looking at about a 94% chance of making it to their 60th birthday at most. In those days, per capita expenditures on healthcare tended to be about $2,000 per capita at most. These dollars in constant 2020 dollars, just to make sure everything is consistent. Here we'll throw the US and Switzerland down on the graph, and you'll see that the average 45-year-old woman in America had about a 91% chance of making it to 60, and the average Swiss woman had about a 94% chance of making it to age 60. The cost was pretty similar, but the survival was quite a bit different between these two countries. There were a whole bunch of other countries down. In 1985, the US is already off this chart, and it's off the chart not because its life expectancy or survival increased, it's off the chart because costs were so much higher than they were in any other country. In fact, as other countries moved off the chart because they became healthier, the United States barely budged in terms of 15-year survival. 2005, nobody's on this chart. All of the European countries have gotten much healthier, and the United States has gotten much more expensive, but hasn't really improved that much in terms of survival. We submitted this for publication. Health Affairs only allowed us one figure, and this was kind of a perplexing request. It was, how do you actually draw a line between 1975 and 2005 when the United States really hasn't made much progress on one domain, but it's made a lot of progress on another, health costs. You see, by 2005, the United States still hasn't passed Switzerland in terms of 45-year-old female survival. Well, up till now, I've been talking about American women who are 45 years old. There's a more extreme example, but this isn't a problem by any means confined to this group. We're back to looking at rates, basically, and these lines show a pretty dire picture. We can see that things were looking progressively better through about 2000 and then suddenly got much worse. Hey, what's this guy talking about? Things actually were looking good up until 2000 for Americans, but that's not the case at all. Actually, if you compare this to other nations, it looks terrible. Okay, so what I'd like you to do now is ask yourself, what are the major risk factors that could explain these changes over time? Risk factor to be an explanatory variable, it has to be looking worse over time in the United States than in one of these other peer nations that we had on that graph.